Can the BEAR implant be used to repair a meniscus? Hey, this is Dr. P. Got a problem with your knee? Ask Dr. P. And I got asked a question. Somebody wrote in and said, can the bridge enhanced ACL restoration repair implant, which is made out of a type 1 collagen, it's kind of like a packing peanut, kind of like a sponge. It's a very healing tissue, and we soak it in the patient's own blood. For the purposes of this demonstration, I'm going to use ketchup, but we soak it in the patient's own blood and we use it to sew in between the ends of a torn ACL, and this will compact down and it'll go in between the two ends, and it'll act like a bridge for the cells, blood vessels, the nerves of the ACL to heal back across. Well, will that work on a meniscus tear? Well, the meniscus is the shock absorber cartilage in between the two bones. Here's the thigh bone, the femur, here's the shin bone, the tibia. And so the meniscus cartilage can tear, and in this case, if you look close, you see this tear, it looks kind of like a bucket handle. So this can be unstable, it can flip back and forth, cause locking. So what we'll do is, in the operating room, the only way to sew this together is in the operating room at this point, is sew these together. Now, that usually will heal 85 to 90% of the time, but not 100. So is there any way we can increase the ability of this to heal? And when we soak this implant, this type 1 collagen, in blood, it becomes almost like a hydrogel. So it does actually kind of look like ketchup. It does kind of coat the area, and then it forms like a clot over the top. And it'll stay there. That clot will kind of stay there, and it'll provide a protective surface for healing. And so right now, we don't know for sure. The BEAR implant is not FDA indicated for meniscus repairs. It's only FDA indicated for ACL repair, but it can be used off-label because it has an indication, it has an approved use, and we can use it off-label. And besides, when we repair a meniscus, a lot of times we're doing the ACL at the same time. So we know that BEAR implant is coating where the ACL is healing back, okay? But so it's acting like a bridge there, but it's also coating the meniscus. And preliminarily, we think that may help with healing. The final results aren't in on that yet. I think in the long run, it's going to show that it does. But the bottom line is, a lot of times, inadvertently, we are using the BEAR implant when we're doing a meniscus repair anyway. And if we wanted to use it for only a meniscus repair, it can be used that way. It just has to be used off-label with the proper consent to the patient. And I think you're going to see that it can improve the results of meniscus healing, especially with ACLs at the same time, but sometimes even on its own, and more to come.